Hi, everyone. Thanks for joining the Rheumatology Nurses Society for another episode of the RNS COVID-19 Facebook Live event. So on our panel tonight, we have Carrie Beach from Columbus. Wave, Carrie. And we have Vicki Sales from the Cleveland Clinic. And we have Linda Griddell-Merrick from Rochester, New York. And we have a special guest tonight. I'd like to welcome Eileen Leiden, former, kind of current, I don't know, RNS board member. And she's working in New York City right now in the middle of the COVID madness. And so we brought her along tonight. So we're going to pick her brain and find out what's going on in the epicenter in New York City. So welcome, everyone. So Eileen, would you like to tell us a little bit about what's happening in New York City?
Yeah, it's been a crazy month, to say the least. I just can't believe that it's just a little over a month ago that I started to hear about this, going to meetings at work with infectious disease doctor telling us about, how contagious this is and, how many unanswered questions. We don't know if this is a seasonal thing. We don't know if it's going to come back stronger next year. And then, it's getting out into the public and we're talking to our patients in the clinics and they're asking all these questions and we really don't have any, guidelines really of what to tell them. What do we do with our medications? And we're sort of just all brainstorming together about, the best approach for this. And then the next thing, we're having all these weekly meetings at work about, how, overloaded are the hospitals going to be and what are we going to do? And they're just basically telling us it's going to be all hands on deck. We're all going to be called onto the floors in one way or another. Just be prepared for that. And what happened is, I work at NYU Hospital, but really where I work is the orthopedic hospital, which is separate from that, about 10, 15 blocks away. And so since they don't have any orthopedic procedures going on right now, they decided to make that hospital an overflow of the patients at the main campus. And now also the Long Island Hospital, Winthrop Hospital, which is NYU, also so we're taking the overflow from there, and there's also a hospital in Brooklyn as well. And so I've been doing that, I'd say, for the last 3 weeks or so. I go in on a Monday and a Tuesday, and at first it was a bit chaotic. Everybody who's working on those floors, nobody has ever done that before. They're coming from outpatient places, PAs that usually work in the OR are coming up, surgical nurse practitioners, the orthopedic surgeons have shown up on the floor. And we basically just, all got thrown together to take care of medical patients with COVID. It was really what we were told. And, so it was kind of a nerve-wracking experience, to say the least. So, basically we've now pulled it together where it's a bit more organized, and, we have a nurse practitioner that helps take the admissions, another one that helps with the discharges, and then we split up into these teams. And I have my own panel of patients, and then I work with a hospitalist as well. Actually, it's a geriatric hospitalist that also wasn't normally working in that environment. And we just all do our best. We all communicate. And even though a lot of us don't know this system, everybody's just willing to help, and everybody is just, trying their best. And somehow, we're working it through right now. We're still, I feel we're still busy. I know that the numbers are going down, the admissions are going down, and hopefully we'll start to see that soon. But the reality is we have a hospital that's fairly full right now that is normally, not for that reason. Mostly a surgical hospital, right? So I guess it's, it's going to be a little bit more time. I'm on till the end of May right now. So for 2 full months, I'm on there. So I guess we'll see, after that, if the numbers start to decline.
Wow. So what's happening with all of your rheumatology patients while you're doing that?
Yeah, so we switched over to telemedicine for the most part. So, Mondays and Tuesdays I'm in the hospital, and then Wednesdays and Thursdays I have them booked for the telehealth visits. We do have one point person that will, be available at the clinic should we need a patient to actually come in. And, sometimes we actually have to examine them, right? So it's like things happen, and yeah, but it's been working out fairly well for me anyway, because most of my patients I haven't had any new ones. They're all follow-ups right now, so I know them pretty well, and just trying to get them plugged in, getting them labs as an outpatient, and but and the actual face-to-face is so nice. Sometimes when we can't, we just do the phone call, but the face-to-face, really does, I think make us both feel like we're connecting, on that level, and the patients very much appreciate it. So you feel like at least you're keeping up, right? So, but it's just so interesting because we hadn't done this before, and then it was like overnight, okay, we have to watch these learning videos on how to do telemedicine, and again, it's all nerve-wracking because we never did it before, but it's actually working out quite well, I think. So it'd be interesting what the future holds with that.
Definitely.
Yeah.
And anyone have any questions for Eileen?
Oh, yeah.
I think one of the questions
I
we had
know,
is
right?
we hear
How
so much
about-
in the news.
Oh, go ahead, Linda, you go.
Oh, well, I was just wondering, we hear so much in the news that you don't have enough of the personal protective equipment.
Mm-hmm.
How's that going? Are you getting what you need? Because I worry about you.
Yeah, no, thanks. Yeah. So yeah, at NYU, they are giving us everything that we need, but we obviously have to conserve it. We can't go crazy. But we have, from day one, whether or not we technically needed the N95, because that was more for, we were told you could wear surgical masks if you weren't working, let's say, in ICU scenarios with, like you were involved in suctioning or aerosolization kind of procedures that, maybe you wouldn't need it. But from day one, they gave it to us, the N95, and we have our face shields and the gowns and the what do you call it, the caps for the over our hair, and the gowns and all that. And there was even people on the floors that were just there to like help us with the PPE and sort of like, hey, you're contaminating this, and what, just to remind us, because you're going in there, you're nervous taking care of the patients because you're not sure how they're presenting, and it's our knee-jerk reaction just to like run into the room when somebody's short of breath, and all of a sudden you just have to stop and take those few minutes and just say, okay, I gotta protect myself first, and it takes a couple minutes, to get going, and then you come out, and we have the bleach wipes, and we have these, stethoscopes that we just like bleaching down, and our face shield in between patients. But you start getting the rhythm of it, but it does take a little bit of time to get it going, but definitely there was always enough, there was always enough outside of every room, so I never felt unsafe that way.
That's good.
That's good to hear.
Yeah.
So Eileen, have you seen any of your rheumatology patients with COVID?
Yeah, I have. I mean, I've talked to them on the phone. A couple of them have turned COVID. One of them was admitted to the hospital, and then she was just discharged a day later. Then there was one that she required a few more days of being admitted. She was an RA patient of mine on Enbrel, and she had just stopped it a few weeks before because she was just nervous about everything. And she stayed in the hospital 4 or 5 days. And for her it was, and this is what I see with a lot of the patients that get transitioned over to us. They're stabilizing, but they still have some oxygen requirements, and we can't quite get them off the nasal cannula, and their lungs sound really crappy. And so that was her. She was on and off the oxygen, and eventually she got discharged. Her husband actually was in a different hospital. He also had it, and he was intubated in the ICU, and I'm not sure of what the actual outcome was of that, but that's been my experience. I'd say all in, I probably had 3 patients so far from COVID that I know of.
Right.
Eileen, I have one question for you as far as the PPE. Is your hospital reusing it? Are they re-sterilizing the N95 masks, or are they just throwing them away?
Yeah, we're asked to, they are reusing them. I mean, not reusing them, but we have to put them in a separate bin, and
Okay.
Are you guys doing that as well?
We are. We just started. Yeah.
Yeah. But every week they give us a new one, a new
Mhm.
N95, and then we give our old one back.
So I've heard this thing now. It's been a long, long time since I've worked as a nurse, but I keep hearing about it's beneficial to these patients to prone them.
Mm.
What is that, Eileen? Tell us
I
about
know.
that.
Well, speaking of you, Kathy, I actually, so because I'm not working in the ICU environment, so I'm not seeing any of that. But I also, that's the
Okay.
first time I actually have heard of it as well. And I looked it up and just reading a little bit. I guess it seems that patients that are vented in the prone position seem to do better.
Hmm.
But that's really all I know about it. I never heard of it before this either. My days, I worked in CTICU many years ago, and everybody who was intubated was, sitting supine. So I
Right.
never saw that. Yeah.
Yeah. So
Mhm.
so it's pretty much just the
Interesting.
vented patients. It's not just anybody.
I think so. I
Hard to
think
find.
so now, Kathy, I really, not anybody that by the time they get to us, we're not doing any of that, at all.
Okay.
Yeah.
I was
Okay.
reading in a nursing post or a healthcare provider post earlier
Mhm.
about them doing CPR that way too,
Oh, really?
with patients in the prone position.
Oh,
Yeah,
wow.
Hmm.
Interesting.
which is
Wow.
interesting. Yeah, very interesting.
Yeah.
Yeah.
Hmm.
I didn't hear about that. Wow. Boy, this is a whole different ballgame, isn't
It
it?
is.
It is. It really is.
This is a whole beast, and it's really scary because there's so many questions that are still to be answered, so many unknowns.
Yeah.
Yeah. So speaking of unknowns, Eileen, what's going on with all the studies?
Yeah, so well, one thing I'll say is that when the patients that I'm seeing come over to us, the vast majority of them just coming into the hospital, if they require some oxygenation, this is not a study, but they're really putting them all on hydroxychloroquine and azithromycin for like a 5-day course. So I'm seeing that. But since then, what I'm learning from all the email strings I'm on, what's being approved at NYU. So there's one. It's called PrEP, and it's actually a pre-exposure prophylaxis. So this is for NYU healthcare workers that work in the ICUs and in the ER. So before they go into that setting, so it's giving them the prophylaxis of the hydroxychloroquine, to see if that helps prevent them developing COVID. Then there's another one, and I think this is the Belinda Gates and the Gates study that the hydroxychloroquine versus placebo, which is vitamin C, and this is the post-COVID prophylaxis exposure. So if you knew of somebody that was had COVID and you were exposed to them, so those are those people are just, and these are outpatients that are being put on hydroxychloroquine or placebo, and that recently got approved. There's another one actually using colchicine versus placebo, and these are for outpatients who have COVID, so they're not sick enough to come into the hospital. So it's colchicine versus placebo, which is interesting as well, right? It's, so we have all those going on. Those are the outpatient ones, and then inpatient. When I was first there a few weeks ago, some patients were being put on the Colectra, the HIV combination. I'm not seeing it as much anymore, and that's not a study, but that was just an antiviral option. But the antiviral that is under study is the Gilead drug remdesivir. So, and again, I'm not seeing that where I'm at, but it's happening at the main campus. So that's where all the clinical trials are. And I kind of am hearing it depends sort of what floor you're on and sort of the trials that you're exposed to. So those are the antivirals. And then finally, like for the cytokine storm, the IL-6s and the tocilizumab, of course, we're familiar with that. From what I understand, that's off-label. It's not a clinical trial, but I think I know some patients are getting that. And then we have saralimumab, Kevzara, which is undergoing a clinical trial that had just started.
Hmm.
And there's another IL-6 called clazakimumab, which also I think just started about a week or two ago. And that's a drug that's used to help protect against kidney transplant failure. That's what it was used for.
Okay.
And now that they started using that in trials. So, and I'm sure there's more, like, on the way, but those are the main ones that I know of.
What is the theory
Are
behind
they-
the colchicine?
The theory there, yeah, I'm not.
You know?
Yeah, I'm not. I guess it's the I'm not sure exactly the whole mechanism there, but they wanted to see, obviously, if it reduces, the rate of death, hospitalization, or lung complications. But yeah, I'm not certain.
We know we use it for patients sometimes who have chronic, like pericarditis, right? So it's probably, an
Like an
anti-inflammatory, because I know we have,
right? Yeah,
right.
definitely.
Are
Yeah, it
they
sounds like they've-
testing, like, have you been tested? I'm sorry, Kathy. We're all so anxious to ask Eileen questions.
Yeah, I was. I think of, like, maybe 3 weeks ago, NYU told us that we could be tested even if we were not symptomatic. So, yeah, I put myself in for it, and it was negative. Yeah. But it's it's just reassuring to know that that's available to us. Because those that were being exposed to COVID patients were the ones that were allowed, or if you had symptoms.
How long did it take to get your result?
Within 24 hours. Yeah.
Wow.
Yeah. Actually, I did get it back that night.
Wow.
Yeah. The testing is interesting, though. Like, I saw a couple of patients that were tested negative first, and then because of high suspicion, we tested them again and they were positive. So from what I understand, maybe it's like the sensitivity is about 70% on that, and they're doing the nasal swabs, but sometimes this is the lung secretions deep in the lung, and we're not getting all of that. So I found that really interesting. The 2 patients I saw were quite ill, like, and they had tested negative first and then positive. Are you guys seeing that as well? That they're not all coming back positive?
We're not testing. I mean, our testing is still rather limited here, even though we're in New York State. I wish we were testing a lot more. But yeah, I think we're seeing a lot more negatives than we're certainly seeing positives. And then you do worry or wonder, are they false negatives, and they really do have, it'd be nice when we have antibody testing, I think, but we're seeing it. Yeah.
Right.
Everybody
and then
doing rapid testing?
Is that the 45-minute one?
45 minutes to 2 hours?
Yeah, I've heard of that. I'm not sure. Yeah, I'm not sure.
We just started that this week. We have several different ones that we're testing or trying out.
Yeah, that's great. I mean, and the other thing with the patients, what I'm seeing in the hospital too, is like they're positive, but then they're getting better, and we're trying to send them out to nursing homes or rehabs, and they want 2 negative COVID tests, and we're just testing them, and they're continuously detected, and then they rightly, like, certainly the patients that are going home are asking these questions. Well, if you're sending me home and I'm still positive, and I have to go home to my wife and my kids, what is this all about? And we really don't have the answers. If they're positive, they could still be shedding and still be contagious for sure. So it's hard. It's hard because we don't have the answers, and you understand their anxiety.
Sure.
Yeah.
How about reinfection? Have you seen anybody who was? This is coming from one of our viewers, Sarah. She said she heard about the possibility of being reinfected. Have you seen any of that?
Yeah, I have not, but I've also heard of that as well. That there's you want to think that you're building up immunity, and you're not going to be back again. But I have heard that as well. Scary. It's really scary.
Yeah, it's bad enough to think you might get this once, but geez, to think about getting it twice.
Right.
Yeah.
You know, it's like you got to be a cat and have
fair.
9 lives with this thing around.
I even heard somebody talking about, the antibody test, and it will be amazing, but there's also some people that they don't think actually make antibodies, or there are certain people that,
Mm.
make them initially, and then they're not there anymore a few weeks later.
Wow.
So, there's
Yeah.
just, again, so many unknowns.
Right.
Because with our other scenarios, it's not the case, right? We build up antibodies and we're pretty certain.
Yeah.
All right. Do we have any more questions from our audience?
Yeah.
Carrie is our question
yep.
queen.
What is, Heidi asked, what is the morale of staff that you're working with right now?
Yeah, well, the people I'm working with are fabulous. They're all showing up. They're like, okay, like I had this surgeon the other day. He's like, I haven't done an admission in 20 years. But, all right, we're just like, okay, when the patient comes, we're all coming to your rescue, because I was like that 2 weeks ago. And for that, everyone's just stopping and just helping each other out with, and I'm the one who's asking a million questions all the time as well. Also, one of the hospitals we work with, his wife has tapped into all like the food venues in New York City that are donating free food. So every day, we're almost getting used to it. He just texts us at 12 and he's just like, we have free lunch again. And, they, and it's things like that, like where literally, you're really not sitting down. Like, I mean, it was hard for me just to walk upstairs to go to the cafeteria, and, because we're just, again, because you're also just going on and off the PPE, and you're just, going. So just those 15, 20 minutes, we just kind of all sat together and just grabbed a bite, and we were just so grateful, just to kind of forget about it, for a few minutes. So I again think the morale has been fantastic for people who, this is not what they normally do at all every single day, and everybody was pretty darn scared. So it's been amazing, actually.
That's great.
Like, everyone wants to do what they can to help.
Yeah.
So I have a question about like your usual protocols and charting and vitals and things like that. Are you guys like so overwhelmed that you really have to, kind of back off on some of the usual protocols to just get through the day?
Yeah, I mean that. Yeah, I think I know what you're getting at, but yeah, I'd say in general, yeah, you just, I mean, I'm doing everything like I normally would, for sure. So, but I think you do kind of have that, mentality of just prioritizing about, what you have to prioritize with, and I think people are understanding, that things maybe aren't going to be as perfect with policies and procedures. But in general, they haven't been really, even though it's super duper busy, because we have a lot of people, a lot of hands on deck. Like sometimes I just have 3 up to 5 patients. So that part of it hasn't been really that bad. I feel as though they're getting good care, and we're still following protocols.
Okay, that's
How
good.
about families? So we know they can't have visitors. Are you doing facilitating a lot of patients talking or providing? I heard in some of the hospitals in New York City, iPads are provided and that type of stuff. Are you guys helping with that?
Yeah. No, there's a lot of that going on. It's so upsetting. I mean, I most every day, will be on the phone with the families a few times a day to give them updates, and there's a lot of the going with the FaceTime on the phones or the iPads as well. Yes. Yeah. It's very, very isolating, especially the whole husband and wife. I saw that a few times where, the husband's in a different hospital, sicker, somewhere else.
Wow.
Yeah, they're really separated.
So difficult.
Part of it's really hard. Yeah.
So are there support systems in place for you guys when you're, the emotional toll that it takes on you guys, the amount of death that you see, or, just seeing the patient suffer and not having that support from their family that they need?
Yeah. yeah, there is a lot of support. We get emails all the time about, mental health services, for ourselves, just to talk it through, for sure. I mean, personally, yeah, there have been, a few deaths, but, I haven't been dealing with that, on a personally with my patients, as of yet. But I think that we have some DNR patients, and we may start getting more of them, and be doing more. I don't know if it can be quote unquote like hospice, because I don't know that we're really, able to do that. We're not credentialed to do that, but there has been some talk of bringing more of those types of patients and having those conversations. But, working with the geriatric hospitalists as we are, and there are nurse practitioners up in the main campus that we get on the phone with, that do more of that kind of those kinds of conversations with the patients. So I guess the answer is that the right people are in contact with those people that do that more day in and day out. But you don't know. I mean, we get emails about all that. About we may have to go down that road, and we may have to learn more about how to actually give hospice care and all that. But yeah, it's every day, every day. Before I go in on Mondays, I just go through all my emails and try to update myself on all the new policies or what I need to know, to get through that day. Yeah.
So what does your typical day look like outside of your work day? What do you like? When do you get up and start your day, and what are you doing for self-care?
You mean when I'm not working?
Mm-hmm.
When I'm at work, I mean, yeah, I am walking. Like there's no, I mean, I'm going with my mask on, and yeah, I have to, just this whole being inside all the time it just makes you crazy. I'm sure you guys can totally relate with that, and it's just stressful. So just getting out in the sunshine and just having other distractions, walking around a park, looking at a dog, or, whatever it is. I have a friend who lives in my building, and, we walk obviously 6 feet apart, but we just, walk and chat. And I think we did a couple of almost like half marathons. We did like 13 miles a couple of times, like over the last couple of weeks. We just kept, like hiking all around like Manhattan, and yeah, and then talking to friends, and I'm sure you guys are doing it like this, like Zoom, and you get everybody on, people you haven't talked to in forever. So there's been a lot of nice things. I'm sure you guys can relate with that as well. You're probably connecting with people you haven't in a long time. Yeah. There's always a silver lining, right?
Yep.
Yeah, absolutely.
It has to be.
Yep.
Mm-hmm.
Well, that's good. I'm glad you're taking care of yourself, and you're not in a bad place. I'm glad you're in a really good place.
Yeah, thank you. Thanks. Same with you guys, right? We're all in this.
Mm-hmm.
Oh yeah.
Yeah.
Carrie, do we have any more questions from the audience?
Yes. How, and this may be different for everybody, but how are you guys, have you changed the way that you're doing vitals? Because we have in our office, has anybody else changed the way that they do vitals?
You mean with with telemedicine?
Well, yeah, actually that was the question, was with telemedicine.
Yeah, because we're not, like with the televisits, we're not.
Even in our office, we've actually, we're not, I believe infusion is still doing blood pressures, but we have been asked not to have any contact. So no blood pressures, no pulse. I actually had my first telemed visit with my doctor, with my family doctor, and they want you to type in your vitals, but I was able to guess my height and lie about my weight, and then they're like, "Do you have a blood pressure?" I wasn't prepared, so you could enter all of that on your own.
I didn't know that.
And we're still doing all of our vitals for all of our patients, anybody that actually comes in the office, and then the infusion room is still doing all of theirs.
Yeah, and infusion is still doing everything. Just the patients that we're seeing just for like injections or whatever, we're holding off on blood pressures right now.
When you're taking temps, I was kind of surprised. Are you guys all doing like the temporal temperatures for the most
We
part?
have we have like
Yeah.
the little forehead gun.
Yeah, we do too.
I went and
then
donated.
today was the first day I walked in to the Cleveland Clinic, and they actually had thermal scans. I was surprised. They used to have people standing, at entrances just taking your temperature.
Mhm.
But today they had thermal scans, so you just keep walking. It was kind of neat.
Oh, wow.
Oh, wow.
That is pretty
That's
neat.
cool.
Wow, how's
Yeah.
that work? They walk
I have
through
no
something,
idea.
or is it just like a gun
No.
that shoots them, or?
It's not even that. It almost looks like security cameras as you're walking through, and they're
Wow.
placed in different spots. And as you're walking through, I guess it takes your temperature. I would have to look it up. I was kind of surprised.
Wow. We'll
But
have
there's
to see
nobody
how that
there,
works
like-
out for you guys in the middle of summer.
Yeah.
I know. And like this morning, it was freezing cold here. So I'm like, how did that get my temperature after coming in from outside?
Accurately.
But
I
yeah.
wondered about that with ours because, of course, ours is right as you come into the building
Right.
where we're taking temps. I wonder about the accuracy. Like as soon as they walk in the door and we scan them.
Well, a lot of times they have
Mhm.
to like have me lift up my sleeve or something if I was just outside, and they'll take it on my arm, or they'll take it,
That's a good idea.
something
'Cause
like that. But the thermal scans, there was somebody sitting with a computer. So I don't
Okay.
know if that person saw your temperature. I'm going to have to look into that a little more. It's kind of
That's
interesting.
really interesting.
Yeah, it's like
I
20
haven't
seconds.
heard that one yet.
Yeah,
Yeah.
that's pretty interesting. I like that. That may be
Yeah,
the
I
way of
only
the
asked
future.
'cause I donated blood last week, and they were still
Mhm.
doing oral temps,
Oh,
and
Really?
it was a little uncomfortable for me.
Yeah.
And it's, believe me, I love the Red Cross, and that's why I went and gave it to them. And I think sometimes they're limited on supplies also, but
Yeah.
I just thought that was interesting. I had to take my mask off so they could take my temperature. So I was like,
oh.
yeah, that was different, but still important to donate blood because it's, the blood
Mhm.
supply is so low right now. So it's okay. But
It's good.
Yeah. Good work.
any more
So,
questions for us?
I do. I have a question from one of the patient organizations that we work with, the International Foundation for, I think it's autoimmune arthritis. But they said that they were having issues with patients who get infusions. Right now, they're able to get appointments, but they're worried that they're not going to be able to soon due to space limitations. Have you, so I know in our office right now, our infusion, and I know I've talked about this before, but we've moved, I think we have 6 chairs now out that we've spaced out into a different part of the building. And with the, lack of patients that we're seeing right now, we could still expand on that more. So we're not having any issues with patients being able to get in and get their infusions.
Well, I'm more worried about, not right now. I mean, we're still pretty full.
Mhm.
But my worry is that the people that are canceling now, and they want to wait a couple of months before coming in because they're afraid to come in.
Yeah.
So I'm worried about what's going to happen in June and July when all
Mhm.
of these patients need to get in for their infusions.
Yeah.
So I've been proactively scheduling all of our IVIGs and rituximabs that I can find into, June, July. Actually, I'm scheduling them to the end of the year, hoping that at least, we can get as many in as possible that always come, come monthly or come every 6 months or every 4 months.
Right.
So I see it as being a big problem starting in probably June or July.
Okay. Interesting.
Yeah, something that we're starting to see up here is we're starting to see a lot of furloughing. Our hospital is furloughing about 500 people this week, and
Wow.
there's still more to come tomorrow, and we're just kind of wondering. We have a hospital up here, not one of our system hospitals, but a different system, and they have a hospital that's completely empty. They've furloughed every single worker out of that hospital, and there are no patients.
Wow.
I think what's happening here is I think we're preparing for the second wave.
Mhm.
I think that's what's happening.
So are they furloughing nurses, like healthcare professionals? And
Yes.
wow.
Yeah.
To places that
And that's because there's just not enough work.
They're not relocating them. They're furloughing them. They're laying them off.
Laying them off. Wow.
Yeah, the layoffs are until like mid-July.
Wow.
Oh my
Yeah.
goodness. You never thought you would hear that.
Mm-mm.
I know,
That's
right?
incredible.
Yeah.
That's scary.
Well, we certainly can use them here in New York. They want to come to us.
They're going to need them here. I'm not sure what's going on, to be perfectly honest.
I
It
figured
doesn't-
you guys would need them in Detroit, right? I
Mhm.
mean, you guys are seeing so many
They do.
COVID patients. Wow.
Yeah, I'm really
Well, we're
really
seeing all
shocked that
the,
I'm really shocked that the pediatric nurses and nurse practitioners. I'm really surprised that we haven't just been reassigned like you guys, Eileen.
Yeah.
They just the adult hospitals are just dying. I mean, they're just so overworked and over.
'Cause you guys,
They're at capacity. They're not so much over capacity, I don't think, yet right now.
because you guys are all over
I-
the news, as a hot spot. That's
Hmm.
yeah,
really
that's
surprising
amazing.
to hear that.
Yeah. Well, we were in the news yesterday because our
Yes, you were.
You're in the news a lot.
it's like I know. I looked at that and I was like, oh no.
Looking for
We're
you,
not- we're
Kathy.
not
See
all-
if you're out there.
Like we're not
Oh,
all
that's
like
terrible.
that. Come on. It was so awful. Our governor, she's really doing a great job, and they're
Mhm.
just they're just really making it tough.
Yeah.
But I have a feeling she's going to be forced to lift the stay home, stay safe order at the end of the month, and
Terrible.
I think the hospitals are starting to get ready for the second phase, the second
Right.
wave, because they know it's coming.
Yeah, that's pretty much what they're doing here in Ohio too. I mean, we're very blessed. Like, I think we're doing really well as far as amount of patients here. But yeah, the governor today said May 1st was going to start, not open everything up. Everything's going to be in a phase, but I think we've also had a lot of protesters. So I think telling them kind of what they want to hear, that they're going to lessen some of the restrictions starting May 1st.
We were
I
told
think
that
in New York we were extended today, right, Eileen?
Yeah,
Oh
yeah,
yeah,
for another month anyway.
We're going through May 15th now. That was our governor's today. Going
May
out to
15th.
Wow.
Okay.
The
I
people
think that's a
here
smart
will
move.
seriously lose their minds if our governor goes to May 15th. They will lose their minds.
Are you May 1st right now, Kathy?
Yeah, the end of April.
Ish. Okay.
Do you think they're going to open schools?
No, she's already closed those for the rest of the year.
Oh,
So
okay.
schools aren't gonna
Ohio
open.
has not. Ohio.
No, we
has not.
haven't. I see
They
that
haven't
happening,
closed them
but
for the end of the year. Wow.
Yeah, I
I don't
don't
see people going back to school.
I don't think they're gonna go back to school. As much as I wish they could.
The whole
Uh,
working from home thing has been a challenge, but the folks that have the kids at home that are doing the
Oh my
homeschooling,
goodness.
I'm not
Right.
even.
honestly, I don't know how you guys are doing it.
It's
My
very
heart goes
tough.
out to you.
It's very, very. Yeah, it's not fun. I'm not working from home, so my husband is. So
Oh.
he's, in the office actually taking calls. He's very busy, and so it's very frustrating. You have to pretty much. That's my full-time job when I'm home, and thank goodness I'm only working 2 days in the office now, so I can at least be home those other 3 days to. I have to literally walk my third grader through every single assignment. Sit there while she's doing it. It's and they don't, technology. They're used to iPads and phones, but a laptop's a little different. So anyway, it could always be worse. So we did get a question. What are the highest risk patients that should still be seen by rheumatologists?
Vasculitis.
Good one. Vasculitis,
Definitely.
yeah, for sure.
Definitely.
Yeah.
Anybody
Yeah.
else?
You mean like coming in and not on the telly?
Yeah.
medicine?
Yeah,
Yeah.
I think most of ours are vasculitis that are actually coming to the office.
to the office.
Yeah.
Mhm.
Yeah,
And the-
that's pretty much what we've had coming to the office. That or today I saw someone in the office that was a new diagnosis, JIA, that was just
Mhm.
started on naproxen, and it's a spondylo. So I had to see him today. I knew she needed to be moved on.
Yeah. The sicker lupus patients.
Yeah.
Right.
Yeah.
And people, like I sent somebody in for tomorrow because she's got bilateral, just terrible knee effusions.
Mhm.
You know,
Yeah.
she's postpartum, starting to flare after that baby,
Mhm.
and just terrible, bilateral knee effusion. So, like Eileen said, we have somebody that's in the office, so I'm sending her in tomorrow to get some of that fluid drained off and get some steroids and hopefully we got her back on some treatments. But
Mm.
and I think it depends. I think every provider has a different level of, your patients, if they're calling you, if you can manage them or not by phone. Some patients, it's just hard to tell. I did a home visit, a tele video visit yesterday. And this knee effusion was easy. Like lift up your pant legs. That was really, really
Right.
easy. This lady, I was looking at her hands. I honestly couldn't tell if they're swollen or not, and I had her gripping, make fists and trying to figure it out. She was a new patient. I was just trying to sort through that. I'll see her in a few weeks when we're back up and hopefully in the office. Because it was that was hard. So I think you just have to gut and know your patients. And if you don't, just kind of make
That's
the best
gotta be
judgment you can.
really hard to do new patients that way.
Mhm.
I know
It is.
the physician I work with is doing them. Some of our physicians are not. That my physician's always all for, let's try it, let's see how it goes. And she said it's hard. It's definitely more difficult because you don't know the
It is
patient.
hard.
But at least
Mhm.
we can kind of get that relationship established, and then she can still order labs and appropriate testing.
Right.
So
Yeah.
And I think it kind of helps the patient because they're talking to somebody. Otherwise, we're telling them we can't
Right.
see them for however far out.
Who
And at
knows
least
how
that's one patient said, at least
Yeah.
I'm talking to you, and I've waited for this appointment for months, right? They've been waiting 6 months already. And she said, and so I put lab orders in. I told her to go when it was convenient. She didn't have to rush out there, but she went today. Already got her lab results.
Yeah.
But it was important to her. It was important to her that somebody still spoke to her, even though
Sure.
if nothing else, I got a good history. You do listen to the history a lot more careful when you can't do a good physical exam, I think.
Yeah.
So you're listening to that history and, so picking up on other things, and hopefully shortly, a very short amount of time, we'll be able to see her in clinic and do some more specific testing. So
I
it
know,
still
it's
serves a purpose. I think it does.
Yeah, we can get by, like, right now, like what you're saying, but we're all hoping, like, in a couple of months time, yeah, we will get to be able to see them back in. And I mean, this is not going to be good for the long term for certain people, for sure.
No.
Yeah.
Yeah.
Yeah. I definitely miss my little people.
Yeah. Aw. Nothing like being able to just hug them, right?
I know, that's so weird because I do that, with some of them, not, of course, not
Yeah.
all of them, but like the little girls and stuff, they just want to hug me and stuff, and I'm thinking, gosh, am I going to have to be wearing this TV all the time? Like, is this our new normal?
Yeah.
Yeah.
Being
May well be.
Yeah.
hugging them, and it's just so weird.
Yeah.
It is weird.
We're meant to be with each other, right? Isn't this so?
Yeah, it's so counterintuitive.
Yeah.
It is.
Mm-hmm.
Not nursing at
Part
all.
of our
Like, I don't feel
profession,
like
right?
I'm doing nursing
No.
at all right now.
No, it's very strange.
It is.
And it's sad to think about the future. They're talking about in New York maybe closing the beaches for this summer, and concerts that you have planned for a few months from now. I mean, I know in reality it's probably going to have to be the way, but it's just you don't want to think about that.
No,
right?
it's a little depressing.
Months and months ahead. Yeah.
Mhm.
Yeah, it's sad. I mean, we're used to living in the United States of America where we have all these great freedoms and,
Right.
go to all these events and,
Mhm.
are safe and don't really think anything about it. And now it's just really
Yeah.
It's really
Or
rocked
like
our world and turned everything upside down.
people have had to postpone their
Correct.
weddings. Like a cousin of mine
Mhm.
talking about it. We were like,
Yeah.
yeah, I mean, like how people dance together. How could you have a
Yeah.
wedding where you're not socially engaged with each other?
Mhm.
Yeah.
Mhm.
Yeah.
Certainly changed our world.
Mm-hmm.
So I have another question for you guys, related again to infusion. Has anyone heard of any reports of drug shortages at infusion centers?
No, our infusion centers have been doing really well with
Mhm.
drugs. We haven't had any problems.
Same here.
And I haven't heard that our infusion center staff is furloughed. I would not see that happening.
No.
Mhm.
I don't think it could happen. Even if they closed our building, I think they'd have to relocate the infusion patients. But I think if anything stays open in our building, that's the part that will stay open.
I agree 100%.
Yep. We've kept all of our infusion nurses
Right.
full time. Everybody else is kind of, I mean, we're getting cut back on our hours. Luckily, we are very fortunate to be paid for those hours, but yeah,
But the
definitely
problem-
infusion staff is full going.
Well, and the infusion patients need their infusions, and a lot of them, if they don't have them, they're going to end up in that high-risk hospital.
Right.
And I think, to prevent that, we're going to have to keep them, in our setting.
Mm-hmm.
Mhm.
We're
Yeah,
going
I
full
think-
steam too.
Yeah, I think it was about a week or two now that I did have one of my infusion kids getting Actemra, the tocilizumab, and for a systemic onset JIA, and her medication was being given to a COVID patient, and so they called the mom and they canceled her. So I did have a conversation with the manufacturer on that, and the problem is that some large hospital systems have been stockpiling that medication.
Mhm.
Mhm.
And so I believe on our COVID website, there is a resource that if you're having that problem with
Mhm.
tocilizumab, there's a national person that you can get in touch with if you're having that problem. So go to our COVID-19 Resource Center, and you should find some additional resources there if that is a problem for you.
And I know many of our pharmaceutical companies have been reaching out to us and
Mhm.
asking us if there's any issues with shortages and
Yep.
even bridging people, because we're anticipating lots of people are going to lose insurance down the road, right? That,
Yeah.
unemployment rates are going to go up. And
Mhm.
so I think I had at least three emails today from different pharma representatives, telling us that they will have bridge programs available. I believe AbbVie just sent one to RNS actually, that they will have bridge programs put up to help patients so they can still get their medication. So,
Mhm.
just reach out. I think if anybody's seeing any kind of shortage or not getting meds for their patients, to reach out,
Mhm.
see if the companies can help in any way, as Kathy did with her patient.
Yeah, and definitely let us know, because we're putting that up on the RNS website under the COVID tab. So let us know if anyone is having issues anywhere.
Mhm.
Yeah.
Yeah, absolutely.
Yeah, I agree. The companies have been reaching out to me left and right too.
Mhm.
I can
Yeah.
be anticipating.
Yeah. That's true. The last thing we want for these patients to flare, then one of the questions is patients who are scared and they want to come in, but you don't want them to flare to end up
Right.
being in those emergency rooms or admitted
Mhm.
into those hospitals. And that's
Mhm.
one of the things I talk about when they want to stop their meds, or do you think I should stop
Right.
my meds? It's like, oh my goodness, no, I don't need you flaring. We don't need to give
Mhm.
you a bunch of steroids right now,
Mhm.
and to really kind of have a nice conversation with them around
Mhm.
those risks that they're taking
they're-
if they stop their meds.
When they're active, they're more increased risk of infections too.
Right. Right.
Right.
I think it's just a good education point. I know, especially for our infusion patients, all of our infusion patients are getting calls from one of our physician's assistants 24 hours before their infusion to discuss, why they really still need to be on their medication and all of the wonderful precautions that we're taking in our office to ensure that they're safe. So I think that's helping them. They from all the patients that then they call me, you know, well, they told me that it was. I'm like, yes, it's safe. They're, you know,
Is
no
it
one's
really
lying
true?
to you.
But are you
They
getting?
all say they do feel better. They're like, oh, I feel so much
Mhm.
better knowing, because I mean, I have a patient that
Mhm.
calls me every week. She's like, is it still safe for me to come in? Yes, still safe.
Mhm. I'm getting a lot of people that just haven't even haven't talked to, and they just stopped their medicines. They
Oh
just
yeah,
provided
yeah.
themselves that. Yeah.
That's what scares me the most, are the ones that aren't calling me.
Hmm.
Right. That's
Because
true.
didn't you say, Eileen, that you had one of your COVID patients that was also a
Yeah.
rheumatology patient had stopped
Yeah.
their
Yeah.
medication?
And I think to their credit, I think, because we coach them so much about, if they have
Yeah.
fevers or infections, you need to hold it. And they just sort of put that in the same bucket here.
Sure, absolutely.
Hmm.
The
Absolutely.
risk.
Yeah, they think they're preventing the
Yeah,
infection.
exactly.
Mhm. Yeah, I've gone down to just explaining that your immune system is already dysregulated by the disease, right? And yes, you have this added risk, but just kind of talking them off the ledge a little bit and kind of stepping back and talking about the disease process sometimes help
Mhm.
them to just
Yeah.
focus about why I'm taking the medication and why I don't
Mhm.
want to have a flare and how bad I feel and how sick I feel when I'm in a horrible flare before I was treated. So
Yeah.
it takes, we're certainly spending a lot of time talking to our patients.
Yeah. And, I wanted to mention earlier too, we're actually doing a registry. I know there's a few of them around, but, just to kind of, look at all the patients, the
Mhm.
rheumatology patients, to see who have COVID, who's taken their biologics, who's not, and just we're collecting all that data in real time now. So it'll be really good for us to learn, right?
Are you doing that through Epic, Eileen? Is that a program you get set up through Epic, or how are you doing that?
Well, it's an NYU registry, so we send
Okay.
all these patients to the email that's provided to us here, and they're just collecting all this
It's
data.
a great one.
Hmm.
That's
And
tough.
one more question, guys, from Linda, not our Linda, but she wants to know, how can case managers help their patients with outreaching to RA patients right now?
I guess I don't understand what the case manager is, so maybe somebody else.
Well, I think it's just,
somebody
I
from
think
insurance company?
it's the same thing that I think we just need to educate patients on what flaring of their disease can do, how that can put them at an increased risk for complications. I think again, it's just trying to reassure them that they need to take their medications and
Okay.
one more. Angela wants to know, have you seen any patients already on hydroxychloroquine come down with COVID?
How many COVID positive patients? Yeah.
I haven't had any positive either.
What do you
Negative.
think, Eileen?
No matter what med they're on.
Yeah, no, the one that I had, actually, she was taken off of hydroxychloroquine a couple of years ago because she had some retinal toxicity. But yeah, no, the other two not. Yeah, but that's definitely stuff that, information we're actively collecting in this registry. We just don't have the answers yet.
I think it's been interesting. I don't know if anybody else is getting this. I am getting so many calls and people who were, like your lady, on hydroxychloroquine once, now they want to go back on it.
Oh,
Can I go back on that? Everybody wants back on it.
Everybody wants back on it. I haven't
difficult.
been on it in 4 years. And, okay.
All right, everyone.
Yeah, I need to get back on it.
Thank you very much to our panel today for being with us. And a special thank you to our special guest, Eileen Leiden. We wish you well, and may the luck of the Irish always be with you. Stay safe, friends.
Great to see you all. Yes, happy to be here.
And thank you to our panelists, Carrie Beach, Linda Grinnell-Merrick, and Vicki Sales. And a big shout out to our behind the scenes folks too, Brittany, Kevin, Amy, and Taylor. So let's end with this. When this pandemic is over and it's a part of our history, how will you look back and answer this question? What did being a nurse mean to you in 2020? And my quote for tonight, No, ponder it.
Okay.
My quote for tonight, to do what nobody else will do, a way that nobody else can do it, in spite of all we go through, that is to be a nurse, by Rossi Williams, who is a nurse. All right, everyone. Thank you for joining us tonight, and stay safe and stay well this coming week. And we'll see you next week on RNS's COVID-19 Facebook Live on Thursday night at 6:30 next week. Bye, everyone.
Bye, everyone.
Bye.
Bye, everyone. Thank you, Eileen.
Thanks.
Thanks, Eileen.
Good to see you.